They're marching against the mandate. In just 2 weeks, the NHS in England could find itself short of more than 70,000 staff. That's the number of people that are currently unvaccinated. The government says all healthcare professionals in England must be vaccinated against COVID-19 or face being moved from frontline jobs. That instruction includes Sarah, a GP registrar in Harlow. She's happy to take the jab, but she's not happy about the mandate.
What we're seeing is an ultimatum. Now, I'm in full support of the vaccine. I've looked at the data, I've looked at research journals, and it's showing that it's working. Because what we're seeing is a reduction in the severity of symptoms and also a reduction in hospitalisation, which means less death. And that's exactly what we wanted.
So what reasons do you think there are for healthcare professionals not taking the vaccine?
Some conversations that I've heard is, well, I've had COVID 2 or 3 times. I've got antibodies. Why do I need to take the vaccine? Which is a logical argument. So rather than telling the person, well, I'm going to kick you out of your job if you don't take the vaccine, bring the data that says that if you have the antibodies, why that's not good enough.
The plans for mandatory vaccinations of NHS England staff were announced in November.
The weight of the data shows our vaccinations have kept people safe and they have saved lives, and that this is especially true for vulnerable people in health and care settings. The advice of my officials and NHS leaders, including the Chief Executive of the NHS, I have concluded that all those working in the NHS and social care will have to be vaccinated.
Studies by the UK Health Security Agency on the effectiveness of vaccines in preventing transmission of the Omicron variant aren't complete yet. But one preliminary paper looking at the Delta variant showed the vaccines prevent some transmission in the weeks after a jab is administered. After 2 doses of AstraZeneca, the effectiveness was 42%. After 2 doses of Pfizer, effectiveness was 31%. The British Medical Association and the Royal Colleges of Midwives, Nurses, GPs, Surgeons and Physicians are all encouraging their members to get vaccinated, but they've got questions about whether or not making it mandatory is the right thing to do. But it's not just staff that are impacted by the mandate. Student doctors also have to be vaccinated because they have to spend time in hospitals in order to qualify.
So for me personally, at this current moment, I've chosen not to take the vaccine.
Julia is a 4th-year medical student, but she could be affected by the new rules.
In terms of the mandating the vaccination, it does compromise on fundamental medical ethics that we're taught in medical school, first of those being bodily autonomy, and so that's the right to be able to accept or refuse any medical treatment, and that's a core principle that we're taught from the very beginning of medical school. And the second thing is about informed consent, so ensuring that you're fully aware of all of the benefits and risks associated with any medical intervention, and then the person who is potentially receiving that medical intervention will then be able to make a choice without any consequences. It's ensuring that they are free to be able to make that choice.
Would you be prepared to walk away?
Yes, simply because no medical intervention should be forced on anyone. And for someone in my position, who is a mature student on an undergraduate programme, that would mean the £40,000+ that I've invested into this medical degree will essentially be gone.
For some, the mandate poses big questions about what choice in healthcare means to patients and practitioners, while those in support of the plans believe they're essential to protecting the public. Barring a late change of government policy, NHS staff in England have until the 3rd of February to begin their vaccinations.